Hello. It is me and I am live and my hands are clammy and I'm so nervous. It's so strange to be nervous because I do webinars all the time and they're live and I'm not nervous about those, but I'm really nervous about this. Anyway, I'm going to answer a question that I've had emailed to me about PDA. The question is, I am neurotypical as far as I know. What an interesting thing to say. But have dealt with anxiety and panic attacks for years that are very situation specific. In order for me to successfully combat my anxiety, I have to force myself to go through the anxiety-provoking situations, which obviously requires I have a number of tools to help me manage the anxiety as it happens. For PDA, the experts advise to essentially shield the PDA from the anxiety-producing situation. Can you help me understand the difference in approaches? I can do my best. So, there are a few differences. There is a particular therapy called exposure therapy, which can work for some people. It often isn't recommended for autistic people. So if we just put PDA aside for a second, the anxiety that autistic people experience is a little bit different to the generalized anxiety that neurotypical people experience. Because we are so hypersensitive on a sensory level to our environment, so everything that we can see, smell, taste, touch, and hear, triggers memories, brings up association with old trauma. There's a whole range of ways that we have anxiety triggered. So when the origin of our anxiety is different to the origin of, say, a person who isn't autistic, there are going to be different ways of dealing with anxiety. And one of those is not exposing an autistic person to something that causes anxiety over and over and over in the hope that it will reduce our anxiety, because it doesn't. It ends up traumatizing us. Now, the thing with a PDA is experts don't really say in a black and white sense, I don't believe, that we should always shield PDAs from the very things that cause them anxiety, because we'd be basically locking ourselves away as PDAs and not engaging with life at all. Anxiety, for me as a PDA, means that I have a fight-flight response that is activated most of the time. And I'm a 40-year-old adult who is conscious of my PDA, so I have a toolkit that I use to be able to get through certain things that, trigger that fight or flight response, trigger the threat response, basically. PDA is a complex condition. So we can take two people, just like when we're talking about autism. We can take two people who have a completely different expression of PDA, but also we can take two people who are having a completely different experience of PDA. And the difference will be how much autonomy and how much control they have been allowed to have, and flexibility over themselves and in their own lives. Now, the difficulty with children per se is that we are conditioned as a society to parent in conventional ways, and this, many families will find, will not be aligned with what it takes to parent PDA children. There are so many children with a PDA profile that can cope in a school setting, that are doing well, that are thriving in particular environments that many PDA children aren't. Also, most of the information that we have about children with a PDA profile is the crisis point or the traumatized PDA child. So the child who has had well-intentioned adults supporting them to continue to try school or to stay in school. And so we've exhausted all options because we get to a point where the child then will not get out of bed, or they might start refusing other aspects of their life, like showering, brushing teeth, eating, coming out of their room at all. So this is when we're tipping over into crisis, into trauma. And this is the difference. So if we already begin as a PDA with a brain that has a hypersensitive neuroception, meaning our threat response is so sensitive that it receives the world in a heightened way all of the time, and this is beyond our control. I think it's important to separate the person from the way their brain responds to the world. So yes, I have a PDA profile of autism, but my neurobiological response to the world is not within my control, and it's not my choice. But then there are other aspects about being a PDA that I do have control and choice over. So with that, having the hypersensitive neuroception means I'm already really, really anxious. So it's not that we want to shield PDA people from situations that make us anxious, it's that we do it in a very different way when we try and expose our children to things that are scary for them. And sometimes that might mean withdrawing demands, or what is perceived as demands for us, or withdrawing from school for a little while. It's a really, really complex topic. I do have another client waiting for me 2 minutes ago. Oh my goodness. I will come back to this later, but it's a really important topic, and I think it's something that I'll write about because it's really difficult to cover in 5 minutes. Thanks for watching.